Sleep disorders can range from occasional nights of tossing and turning to the more serious and long-term disorders. The most common sleep disorder is insomnia, in which people feel daytime fatigue due to trouble falling asleep or staying asleep. If you have difficulty getting to sleep or staying asleep that persists for longer than 1 month at a time, you may be suffering from insomnia. Besides being tiring, insomnia is tied to mental distress and impairment of functioning. Sleeping pills can relieve insomnia, however, they may interact dangerously with alcohol, may disturb REM sleep, and may eventually lead to increased sleeplessness. Narcolepsy is a disturbing daytime disorder that is typically first seen in people who are between 15 and 25 years old. People with narcolepsy abruptly enter REM sleep directly from the waking state. Usually, they are laughing or experiencing some other emotional state. Because of the loss of some muscle tone in REM sleep, narcoleptics may experience cataplexy, meaning that they collapse and remain briefly immobile even after awakening. People who suffer from sleep apnea briefly stop breathing hundreds of times each night, waking each time long enough to resume the breathing. In the morning, victims do not recall these awakenings, and however, they feel tired and tend to suffer headaches, reduced attention, and learning difficulties. Sleepwalking occurs in non-REM sleep, usually in childhood. By morning, most sleepwalkers have forgotten their travels. Drugs help, but mostly children simply outgrow this problem. In REM behavior disorder, the near paralysis that normally accompanies REM sleep does not occur, so sleepers move in if acting out of their dreams. If the dreams are violent, this disorder can be very dangerous to the dreamer or those nearby. Drug treatment is usually very effective. Watch detailed lecture on sqadia.com psychology course. That's 2 minutes. See you in the next video.